Well, you all know it's cold and flu season. You can't miss it. Everybody's sniffling and coughing. And we have all heard of the importance of washing our hands to keep from getting sick. But what else can we do to fortify our immune systems? Dr. Andrea Sullivan, a naturopath, joins us this morning to talk a little bit about staying well in this season when everybody seems to be sick with something.
Everybody,
and
that's
most
correct.
people are going to work because they don't feel sick enough to stay home. So what are you saying are the best ways? You've got 3 things that you say are very, very important to staying well.
Well, one of the things we know is that sleep is so important, and most of us don't get enough sleep. We have 4 hours, 5 hours, but sleep is a time when the body needs to regenerate and the cells need to regenerate, especially the immune system, the cells of the immune system. So sleep is very important. Water is important, something as simple as water, because you don't want to get dehydrated during this time. Even though it's a cold time, you need to have perhaps warm water with a little bit of lemon in it for citrus.
And you also say eliminating stress makes a difference in getting well.
Eliminating stress makes a huge difference because your immune system responds to that stress by being depleted, by lessening, by slowing down. So reducing stress, for example, simplifying your life or saying no. What a concept. Most people say yes to everything. Say no. Say no to that church meeting. Say no to something that can be eliminated for the moment. And do something one thing at a time. Most people multitask all the time. I do it sometimes too. But try doing one thing at a time. So those are just a few things that you can do to reduce stress.
And these are things that you should do before you get sick.
Before you get sick.
And I suppose it makes a difference if you're doing them
and especially if you are sick. Exactly. And there are dietary habits that need to happen. Most people go for the sweets and go for the white flour and white sugar. But those substances decrease your ability to heal itself. Decreases the body's innate ability to heal itself because it slows down, actually, the immune system, the white blood cells especially.
So tell us a little bit about the things that you think we should be eating to make sure that we don't get colds and flu.
Well, for example, vitamin C is a great source in these clementines right here that I have. We have some carrot juice here that I'm going to ask you to taste because it's a great source of beta-carotene, which is preformed vitamin A. And vitamin A is excellent for all of your mucous membranes in your upper respiratory tract.
Taste it.
So, and then of course we have some garlic that you saw earlier. It's not bad. See that? See that? It's better when you shake it up, actually, which I didn't do.
For in the grocery store. But you think that carrot juice actually makes a difference in
absolutely
warding off
it does.
colds?
Warding them off and while you're sick because it helps your mucous membranes of the upper respiratory tract. Garlic is a great antibacterial. Garlic is something that's been used for years. Your grandmother wrapped it around your neck or hid it under your pillow or something. Use it as a tea. Cut up a little bit of garlic, as you saw earlier. Put it half a teaspoon or a teaspoon in some hot water and sip on that to prevent colds or even when you get ill. Absolutely.
Well, that's very interesting. But do you think that it is better to have it in the natural source as opposed to taking vitamin C pills?
I think either one is fine, but I think both are necessary because, again, carrot juice is more for vitamin A and beta-carotene. Your clementines are more vitamin C, but you need to take vitamin C also. Most of the time I recommend 2,000 to 4,000 milligrams a day over the course of the day for people who are, especially at work and moving around a lot. When you get sick, I definitely recommend 4,000 milligrams a day over the course of the day.
Tell us a little bit about the herbs that you suggest that we take for colds and bronchitis.
Well, bronchitis especially is a great herb called horehound, and we've been using that for centuries.
Horehound?
Horehound.
Oh, that sounds like
the Latin name is Marubium, but we've been using it since the African slaves came to this country because it's similar to the herbs that were used in West Africa. So horehound is one, lobelia is another that we use for bronchitis. Another is grindelia. So we use all 3 of those herbs in combination in what we call a liquid herbal tincture.
Now your book maybe mentions all of these things?
My book mentions all of these things, A Path to Healing, A Guide to Wellness for Body, Mind, and Soul. I'm located here in the District of Columbia. I've been here for 25 years, thank goodness. And in the book, it has different formulas for colds and flus as well.
Well, we're so glad you came in to talk about it. Oh, I tell you, we've got them here. The cold is going through our newsroom.
Everywhere, I know.
So, and you just told me that you can catch it again even after you've just finished having a cold. So I'm going to be drinking that carrot juice.
Good, good. Get some sleep.
Dr. Andrea Sullivan, thanks for coming in.
Thank you very much.